Hello, how are you doing today? Today we're going to talk about Medicaid, which is a very important program that we provide for people of low income. And this gives them the opportunity to access health care, which is very important because if you're not feeling good, if you're not healthy, you can't get yourself out of poverty. This is for the betterment of everybody. And we're going to talk about billing and reimbursement for Medicaid. So, the first thing you need to know is on a national basis, you're going to go to cms.gov. And when you click on Medicaid slash CHIP, Children's Health Insurance Program, it will bring you to www.medicaid.gov. Okay, so you have two paths for getting there for information about Medicaid. And you will see, if you remember, Medicaid, like Medicare and others, are federal programs, state administered. So what does that mean? That means the program is created and set up by the federal government, but then it's up to each individual state. Now, the federal government determines minimum coverage, and each individual state can then add on to that for whatever they feel their people need the most, which is a good thing because without going to medical school, I think you certainly could understand that patients in Arizona would have different health needs than patients in Alaska or Maine, okay, and throughout the year. So this is important. So you can go here and look at the resources by each state. So each state, and this is different. Remember last week we talked about Medicare, and Medicare, which also is federal program, state administered. There's a lot more information on the website, but here the differences support a more independent submission of claims. So on the federal level, you will find information at medicare.gov. Things that apply to all people in the United States who are eligible, qualify, and are beneficiaries of Medicaid and CHIP, the Children's Health Insurance Program. Okay? Yet, in your future job as a billing and coding professional, you need to become familiar with the South Carolina Healthy Connections Medicaid fiduciary. Okay, so this is going to be your point. Working in South Carolina and submitting claims and caring for patients who are covered by Medicaid. Okay, so you can find this at https://www.szscdhhs. That's South Carolina Department Health Human Services.gov. Okay, now as you look at this homepage, you'll notice that it is focused for the patients. And this can get very tricky, especially early in your days as a professional. When you graduate and you get on the job, it can be confusing for your brain to switch into professional. So what you're going to do on this website is you are going to click Oops, I got them out of order. I'm sorry. Wait a minute. There we go. This should be here. Okay. So here, you're going to click on for providers, because that way you will get the information you need working and helping your patients who are Medicaid beneficiaries within the state of South Carolina. You'll notice that right here they have a provider manual. They also give you information on updates that may have occurred that you may need to be aware of as you are working in the field, okay? You will also notice that when you look under claim submission for Medicaid in South Carolina, they have a web-based claim submission tool. They give you the information that you need with regard to mailing it in. You got a phone number, you got an email address, okay? This is pretty easy, pretty direct. But you know that the law states that they want everything to be done electronically, and that is better for you as a provider. You will get your money back. You will get the reimbursement faster when it is done this way. And this makes it very easy. You don't have to worry about getting your facility to purchase new or updated software. You don't have to worry about interoperability. You just click right here, or you can go directly to this URL across the bottom so that you can make sure that your claims are smooth with regard to your patients who are covered by Medicaid. Okay, and this makes it really pretty easy. Okay. All right. There's also frequently asked questions. And the reason I show you this for the patients is because very often patients will ask you in the provider's office, can you help me? I don't know if I can have this. I don't know how to go about it. Okay. So it is important that you understand the pathways to getting accurate information, because ultimately it benefits you and your clinic, you and your physician's office, you and your hospital. Okay. We all know that my friend Betty, who I ride the bus with, told me this is not necessarily credible information. And even if Betty told me this because this is what she went through, no two people are alike. And it is your job to help your patients. You need to do more. You need to know about these things. And at the very least, you are going to be able to point your patients in the right direction. I'm not telling you to become a social worker, but it is the right thing to help. And this is clicking. Okay. Now, there's one more thing I wanted to share with you. And this is from last week. I put the date on the next slide. March 16th. Yeah, this is from last week. This was published. And again, this is something that I want you to be aware of. Perhaps you know somebody, a relative, a friend who is on Medicaid, or more so for your potential patients, that the ending of the COVID public health emergency, okay, that designation, I mean, it sounds like, and I did this too, you know, is so President Biden has a press release and he says, okay, we're ending the emergency as of this date. This doesn't mean nobody's getting sick as of this date. It is a financial funding governmental thing that goes through the channels from the federal government to the state government to the local government to the people, okay? That that has to do with funding. It's really what it's all about. But it's important that, again, you know, whether it's for yourself, family members, friends, or ultimately your patients, that this imaginary, okay, it's not an emergency anymore, can have impact. And my suggestion is that it should be checked upon. Okay? Because nobody wants to find out they no longer are covered by Medicaid when they're standing in the doctor's office or in the emergency room or in the clinic or wherever it might be. Okay? So essentially, it has to do with how recipients are determined to be eligible to stay on Medicaid. Now, this is not your concern as in determining who's eligible, who's not, in which state, okay? And I did not find anything about South Carolina per se, but the official end of the emergency is coming up. This is from the Kaiser Family Foundation, which is a very reliable and trustworthy source. So we want to, and you'll notice the first bullet in the middle of this slide says about half of the states, 27 out of 50, have been flagging individuals who may no longer be eligible or who did not respond to renewal requests. Okay. All right. So the point is this is also the point for you to subscribe to some newsletters that just come in your email box of industry reliable sources such as Becker's Hospital Review and Health Leaders and HIMA and AAPC's newsletter. You know, their healthcare business magazine. Just flip through it. I'm not telling you to read every word, but the fact is that this is how you build your career, with little bits of information from trustworthy sources. This is very, very important. Okay. All right. Any questions? You know where to reach me. Again, this is my correct email address, safiansc@cctech.edu. Okay. The mycct.ccttech.edu address it goes to the third ring of Saturn. I will never see it. And if you are sending me an email, I definitely want to see it. I definitely want to read it. So please pay attention to this. Put this in your contacts list. Okay. I am here to support you and to help you become a successful professional. Really. Have a wonderful day.